So my name is Kristin Johnson. I currently work in the Office of Clinical Research at MD Anderson, and I am a clinical trials activation specialist. So that means I just kind of administratively activate the clinical trials so that the research nurses can put patients on. I have been a nurse for about 15 years, and I am the past president of the Houston Chapter of the Oncology Nursing Society in 2024. So this year at Congress, I presented my poster, my abstract on empowering the next generation of leaders, the nursing student board member. So to align with the ONS mission of advancing excellence in cancer care by promoting research, education, and advocacy, as well as the Houston chapter's strategic goal of empowering the next generation of ONS members and leaders, we decided that a good idea would be to start a student board member position for our HCONS board. And so in order to do that, we sent out a survey through our contacts in HCONS to a lot of the area nursing schools to gauge the interest of the students. And we had 5 responses. So out of those 5, we chose Joseph. He was our first nursing student board member, and he started in fall of 2024. He was from UTMB and was a member of the SNAC organization, Student Nurses Against Cancer. So this is sort of a great pool for us to pull from because these nurses are already identifying an interest in oncology. We already had a relationship with this group as well. Part of our goals for the year is to do a frequently asked questions session with the SNAC members. It's during one of their meetings sometime during the year, and the HCONS board will join and do a Zoom call with them to answer any questions about ONS, about the Houston chapter, and then about oncology nursing in general. And so with this research, so we decided to add a board member, and we gave a 1 semester time period because the nursing school is so busy in general. We thought 1 semester would be at least a good starting point. And our idea was to have them help in some way, and that is still being determined. It probably will change every semester. Whether that's a donation drive, whether that's a project that they're interested in joining the 2 organizations, or whether that's just something they can help with the board, like social media, then that will probably depend on the individual that's participating. Joseph was able to do a presentation to our board about a breast cancer charity that his group is involved in. And so we're in the process of setting up an online presentation from that charity to our members as well. So while he participated, he went to board meetings, he went to general meetings. Actually, our education event got canceled in the fall. He would have gone to our education event, but hopefully he could participate in the spring for that. And we did do a questionnaire at the end of his term, and he agreed that it was a great experience. He really enjoyed it, got a better idea of what was involved to be a member of HCONS and what benefits he could gain from that and from being in ONS in general. He suggested that a donation drive would be a great way to engage his student group. And then one of his ideas for room for improvement would be the transition process between the board members, which we agreed that could be a little more standardized in the future. So we're working on that. We have also sent out a questionnaire to the general students as well, to figure out if they had other ideas of ways that we could engage and ways that they would like to be involved in HCONS. So we're still gathering responses on that. We felt like it was important to create a student board member position just to gain a fresh perspective. We wanted to know their opinion of how best we could engage the students. We may have our ideas of how best to engage the students, but they probably have better ideas of what would work for them. So we were interested in hearing their perspective. We also know that it can be intimidating for students to engage with a professional organization that they may not be familiar with. So we'd like to kind of break down some of that intimidation factor and let them realize that, we're just nurses. We talk about our ideas. Everyone is welcome to suggest new ideas, and we will discuss them. And we hope to try to make them more comfortable and make them more confident for leadership in the future, because now they know what to expect. And then when they join the professional organization later, they say, oh, well, I've already had some leadership experience when I was a student. And this is not so scary after all. I can definitely make my ideas heard. Absolutely. I think mentoring can have several positive effects on the students. They build a comfortable relationship with their mentor in an ideal situation, of course, and they can ask all the real life questions that maybe they feel like they can't ask their peers because they don't know yet, and maybe their professors because they have a different type of relationship with professors. But with mentors, they can truly say, what is this truly like? How does this truly work? How do interviews work? How does orientation work? And granted, we answer to the best of our ability with our institutions, but we have different board members from different institutions in the medical center. So they're able to speak to, how does the MD Anderson orientation work? How does the Methodist organization work? It gives them a perspective to feel comfortable to ask those questions. And I feel like they might be more geared toward oncology. For instance, if our goal is to pull students from different schools to be participants on our board in the future, not just from UTMB. And so maybe they're debating on whether they want to be an oncology nurse. And hopefully we can give them some ideas as to why they might love oncology. And some of them may not have been exposed to it. And so that's exciting to be able to encourage them toward a career that, all of us already love.